Healing Fam. Welcome to Healing Not Heal, where we will talk about all things mental health and holistic wellness in a very transparent and culturally competent space. So for today, I wanted to talk about behavior activation. I think I hear a lot of the word motivation and just kind of, wanting to feel inspired or have energy for things. So I wanted to describe what behavior activation was and the rhyme and reason behind my own structure and discipline that people feel like they observe in me. This is how my depression works. I can only speak from my experience personally, and you may or may not relate, but I am a certifiable overthinker, overanalyzer. I live in my head all day long. It's actually a pretty cool place to be, but sometimes it can be very overwhelming. It has been a matter of control and discipline and being able to stabilize my mood and not let it control how I show up in the world. My mind will ruminate on things if I allow it to. And if you're a ruminator, the thoughts are usually rooted in anxiety, fear, and being very self-critical of your environment, your interactions with people, and negative thinking, intrusive thoughts, and a lot of negative self-talk. You wish so badly that you could just quiet these thoughts and that they would just stop and go away. But what ends up happening when you have not learned to manage and control your thoughts, the thoughts tend to start to immobilize you, and you start to feel stuck and numb, and the thing that triggered that thought, that anxiety, that catalyst, whatever that goal or passion was, never gets completed, right? You think about something that you want to accomplish and you wait for a moment of motivation or to feel inspired or convicted or to feel confident at some point that eventually that goal or that task will get done. But as you ruminate about all the anxieties and the fears, you stay stuck in that space rather than actually attack the thing. Those with depression or anxiety may need psychiatric intervention in order to develop a level of functioning that they can accomplish some of those goals and daily tasks that they need to complete. I personally use skill-based methods in order to develop more skills because I realized motivation was a fallacy, right? Motivation is a very temporary feeling, and you can't rely on motivation in order to complete the things that need to get done. We will talk ourselves out of a lot of things if we give it the time, energy, and effort. That was a habit that I personally wanted to break. So for me, writing things down, making a list, creating a schedule, following a plan really helped create structure for my life and discipline in areas that I wanted to optimize the time and day. Just stop waiting for something to happen. Discipline is the most simplest and overlooked form of self-love. When we talk about commitment in relationships, be convicted and assess the relationship that you have with yourself. Do you follow through with your own words? Do you follow through with yourself? Do you follow through with your own goals? Do you have integrity on the things that you say you're going to do and the things that you want to accomplish? We want so badly to hold other people accountable for how they say they're going to treat us and show up for us, but we don't show up for ourselves. Do you hold yourself accountable when you don't show up for yourself in the way that you intended? And then when you hold yourself accountable, how do you correct the behavior? Or is it a cycle of the same behavior, undesired behavior that you don't want to exhibit? I'll use the gym as an example. A key thing that I learned from Atomic Habits was prompting and cues. I used to set the alarm, turn it off, roll over, go back to sleep, and never make it to the gym in the morning. Now I set about 5-6 alarms, and I set my phone further away from me so that I actually have to physically get up in order to turn them off. I also like fashion, so I bought workout clothes that I would feel good about wearing once I'm at the gym. I prep my clothes the night before so that there is no searching for clothes in the morning or taking more time or making excuses on what to wear. And when the morning comes and the alarm goes off, I don't give myself that option, regardless of when my head tells me that I don't want to get up and I don't want to be there. I just get up and go. And it's like going to a job, right? You don't question whether you get up and go to work. Maybe you do. You know, when that alarm goes off, no matter you don't want to go, you still get up and go because you know that there are secondary gains to you going, regardless of how you feel about your job. You know, you're going to get a paycheck at the end of the week, 2 weeks, whatever your pay schedule is. Working out is the same way, right? You may not want to go, but you already know in 2-3 weeks, there are going to be benefits of what you showed up for. Nike was just spot on. Just do it. The act of doing the thing then rewards our nervous system, and we feel good about the productivity and good about ourselves. That improves our self-esteem. And you know, you felt more accomplished when you've gotten things done. And so the idea that we get stuck in this rut, although we are aware of the outcome had we do the thing, that's the paradigm, right? And that is why our emotions, our feelings are not fact. So keep a running list of tasks. And even when you're creating a schedule, schedule your breaks, because we're allowed those too. Perhaps you need a schedule until you create a consistent routine where you have more flexibility within your schedule because you trust yourself that you're going to follow through. The goal is consistency, discipline, and grace. The grace is that it's easy to make a mistake and then sabotage and immediately just stop and just give up and just say, I can't do it. That's when the negative self-talk kicks in and it becomes a self-deprecating cycle. And then you self-perpetuate the lack of motivation that you experience because of that one mistake. Instead of just acknowledging and affirming your desire to rest and the grace to have that rest day, but the discipline to get back on that horse. That is an example of all or nothing thinking, is making that one mistake and then sabotaging the entire progress. Like, why should you start on a Monday? Why should you start next week? Why should you start the first of the month? Why should you start at the new year? Just because you missed a day, why can't you start tomorrow? Why can't you start today? Because you're still waiting for that motivation that does not exist. You have to make a conscious decision today to commit to yourself and create a plan of action and follow through with that action, just like you would expect people to follow through with you. So what is behavior activation? Behavior activation is a therapeutic tool used to treat depression and other mood disorders. It's based in the principle that engaging in positive and engaging activities are rewarding to our nervous system and can improve our overall well-being and mood. It's also believed that increased activity and engagement in these activities will help increase the motivation in order to complete other tasks. Engaging in enjoyable and meaningful activities and experiences is positive reinforcement for us, which can reduce the cycle of negative thoughts and behaviors that contribute to depression. Behavior activation can help individuals develop a sense of control and purpose in their life. Is laying in bed and doom scrolling and bed rotting self-sabotage to your mental health? It kind of is. And I would strongly encourage that you do something to get out of that rut, whether it's speaking to a professional, starting medication, maybe establishing some of these prompts, cues, and suggestions into your daily routine. It does take courage and resiliency to push past uncomfortable feelings to do the thing that you desire to do. But look at the alternative of not doing it. That fear may be temporary, but regret can be forever. That feeling of regret can show up in the form of depression. So what are some key aspects of behavior activation? Identify and schedule activities that are pleasurable, meaningful, and related to your own values, and schedule them into your daily routine. Write them down, write things down. I am big about physically writing things down because our phone devices are very distracting and it's very easy to get lost into other activities. But when you write things down, you use a different level of muscle memory that is stored that helps you remember to complete the task. Monitor your activities and identify patterns in your own behavior and relationships. Start to take notice of how you feel and show up, or your mood after these activities. Take note. Increase positive reinforcement by engaging in enjoyable activities. This can counter a lot of the cycles of negative thoughts and behaviors associated with depression. Reduce negative or avoidant behavior. Behavior activation usually starts with something small, some very manageable steps. You can gradually increase the intensity and the duration of the activities as you get more confident and mastery in your motivation. So those steps involve identifying what are your avoidant behaviors. Are you avoiding socializing, hobbies, interests, exercising, things that you want to do? Are you avoiding behavior? Take note of that and do the thing. Come up with steps that will help you activate doing the thing. Whether it's cues, whether it's prompts, whether it's making yourself temporarily uncomfortable in order to get to that next step. And like I said, setting 5 alarms is very uncomfortable, especially when it's an alarm that's like, ah, ah, ah. Yes. Increase positive activities. Again, these are positive reinforcements for you. Monitor and track. I have a habit tracker. I've had a habit tracker for about 4 years now, and I have flourished because of a habit tracker. Then address underlying barriers, any cognitive distortions, any social anxieties, any traumas that are interfering with you showing up in the way that you want to show up. Depression looks different from everybody. There are those with functional depression. There are those with very severe depression. Interventions vary. This is just one intervention. And so again, others might need therapy, others might need psychiatric intervention. So I am just recommending that you go seek help, that you get some support, and don't wait for motivation. Get up and do the thing. Schedule the appointment, get to the doctor, get to your specialist, get to your health coach, get to your therapist, get to your friend, get to your church, get to your gym, get to that office, do the thing, because that's what's going to motivate you to get to that next step. All right, Healing Fam, make sure to like, share, subscribe. Follow me on Instagram at healingcrowncounseling.com. You can also follow me on TikTok, Facebook, and Patreon. And I, again, appreciate you being here with me, Healing Fam. Thank you.